Ever wondered why there are so many different ADHD medications available? It's a question that puzzles many. Today we're pulling back the curtain on this captivating topic. ADHD, short for Attention Deficit Hyperactivity Disorder, is a condition that affects both children and adults. It's characterized by a continuous pattern of inattention, impulsivity, and hyperactivity that interferes with functioning or development. Misconceptions about ADHD and its treatment are as widespread as the condition itself. Some believe it's a result of poor parenting or lack of discipline, while others think it's just an excuse for unruly behavior. But the reality is, ADHD is a neurodevelopmental disorder with complex genetic and environmental causes. Now let's address the elephant in the room. Why are there multiple types of ADHD medications? Well, the answer lies in the diversity of ADHD itself. ADHD doesn't come in a one-size-fits-all package. It affects people differently, and thus, treatment needs to be tailored to individual symptoms and responses. Broadly speaking, ADHD medications fall into two categories: stimulants and non-stimulants. Both aim to manage the symptoms of ADHD, but they do so in different ways. Stimulant medications, which include well-known names like Adderall and Ritalin, work by increasing the levels of certain chemicals in the brain that help with focus and attention. They are often the first line of treatment for ADHD and are effective for many people. On the other hand, we have non-stimulant medications. These are generally considered when stimulants are not effective or cause undesirable side effects. Non-stimulants, such as Strattera and Intuniv, work differently in the brain and may also help improve attention, impulsivity, and hyperactivity. So, as you can see, the world of ADHD medications is diverse and complex, mirroring the very nature of ADHD itself. But fear not, we're here to make sense of it all. Now that we've set the stage, let's dive deeper into the world of ADHD medications. Stimulants and non-stimulants, two major players in ADHD treatment. But what sets them apart? Let's delve into the fascinating world of ADHD medications. Stimulants and non-stimulants, while both effective, operate on different principles and have their own unique benefits and drawbacks. Starting with stimulants, these are often the first line of treatment for ADHD. The reason? They work by increasing the levels of certain chemicals in the brain, which help improve concentration and focus. This is a huge boon for those struggling with ADHD, as these medications can provide immediate relief from symptoms. Yet it's not all sunshine and rainbows. Stimulants can come with a host of side effects, including sleep problems, decreased appetite, mood swings, and even heart issues in rare cases. Another point to consider is that these medications may require frequent dosage adjustments to maintain their effectiveness and reduce side effects. On the flip side, we have non-stimulants. These may be a good option for those who can't tolerate the side effects of stimulants, or for whom stimulants haven't worked. Non-stimulants don't work as quickly as stimulants, but they can last up to 24 hours, offering a smooth, all-day control of symptoms. They're also non-addictive, which is a significant advantage. But like their stimulant counterparts, non-stimulants are not without their drawbacks. Side effects can include fatigue, nausea, and decreased appetite. And similar to stimulants, finding the right dosage of non-stimulants can be a trial and error process. So, what's the bottom line? Both stimulants and non-stimulants can be effective in managing ADHD symptoms. The choice between the two often depends on individual factors, such as the person's symptoms, overall health, the presence of any coexisting mental health conditions, and their response to medication. As you can see, both stimulants and non-stimulants have their own sets of pros and cons. Choosing the right treatment for ADHD is a personal journey, and what works best will vary from person to person. We've taken a whirlwind tour of ADHD medications, but what are the key takeaways? First and foremost, ADHD medications fall broadly into two categories: stimulants and non-stimulants. Stimulants are often the first line of treatment, and they work by increasing the levels of certain chemicals in the brain that help with focus, attention, and impulse control. Non-stimulants, on the other hand, may take a bit longer to show effects, but they can be a good alternative for those who can't tolerate stimulants or need round-the-clock symptom management. What's really important to note here is that, like any medication, ADHD drugs come with potential side effects. These can range from minor nuisances like dry mouth or insomnia, to more significant issues like increased heart rate or blood pressure. That's why it's so crucial to work closely with a healthcare professional when deciding on the best treatment plan. And speaking of treatment plans, remember that medication is just one piece of the puzzle. It can be incredibly helpful, yes, but it's most effective when combined with other strategies like behavioral therapy, exercise, and a healthy diet. Each person with ADHD is unique, and what works best for one might not work as well for another. So it's all about finding that individualized approach that fits. Don't forget too that the world of ADHD medication isn't static. Researchers are constantly studying new treatment options and refining the ones we already have, so what we know today might evolve tomorrow. That's why it's essential to stay informed, to ask questions, and to keep an open dialogue with your healthcare provider. In short, ADHD medications can be a powerful tool in managing symptoms, but they're not a one-size-fits-all solution. It's a journey, and like any journey, it requires patience, understanding, and the willingness to adapt. Remember, understanding is the first step to managing ADHD effectively. Stay informed, stay healthy.